what are autoimmune skin conditions, and how do they differ from other skin disorders. Autoimmune skin conditions are disorders where the immune system mistakenly attacks healthy skin cells, leading to inflammation and various symptoms. Here are some common autoimmune skin conditions and their differences. Psoriasis, characterized by red, scaly patches on the skin due to rapid skin cell turnover. It can also affect joints, psoriatic arthritis. Eczema, atopic dermatitis, is a chronic condition responsible for itchy, inflamed skin. It often occurs in individuals with a family history of allergies or asthma. Lupus erythematosus can cause a butterfly-shaped rash across the cheeks and nose, along with other systemic symptoms affecting multiple organs. Scleroderma, a condition that results in hardening and tightening of the skin due to collagen buildup. It can also affect internal organs. Dermatomyositis, characterized by muscle weakness and a distinctive rash that may appear on the face, chest, or back. Vitiligo causes loss of pigmentation in patches on the skin due to immune-mediated destruction of melanocytes. Alopecia areata. This leads to sudden hair loss in round patches. It occurs when the immune system attacks hair follicles. The main differences among these conditions lie in their specific symptoms, affected areas of the body, underlying response of the immune system, and potential systemic involvement beyond just the skin. What role does genetics play in autoimmune skin conditions? Genetics plays a significant role in the development of autoimmune diseases. Certain genetic predispositions can increase an individual's susceptibility to these conditions. Key points include family history. Autoimmune diseases often run in families, indicating a hereditary component. Specific genes. Variations in specific genes, such as those related to immune system function, e.g., HLA genes, have been associated with various autoimmune disorders. Gene-environment interaction. Genetics may interact with environmental factors, like infections, diet, and toxins, to trigger autoimmune responses. Immune regulation. Genetic factors can influence how the immune system regulates itself, potentially leading to inappropriate attacks on the body's healthy tissues. In summary, while genetics play a part in autoimmunity conditions, improving environmental influences and lifestyle choices can often override bad genetics. How can environmental factors contribute to triggering autoimmune skin disorders? Environmental factors can contribute to triggering autoimmune diseases through various mechanisms, including infections. Certain viral or bacterial infections can initiate an autoimmune response by mimicking the body's cells, leading to cross-reactivity. Chemical exposures. Exposure to toxins, heavy metals, and certain chemicals, like solvents, may trigger immune dysregulation. Dietary factors. Some studies suggest that specific dietary components or deficiencies, e.g., gluten in celiac disease, can provoke autoimmune reactions. Stress. Chronic stress may affect immune function and exacerbate autoimmune conditions. Hormonal changes. Fluctuations in hormones, particularly during puberty, pregnancy, or menopause, can influence the onset of autoimmune diseases. Microbiome alterations. Changes in gut microbiota composition may impact immune system regulation and contribute to autoimmunity. Climate and geography. Certain geographic locations with varying climates may have higher incidences of specific autoimmune diseases due to environmental exposures or lifestyle factors. Understanding these factors is crucial for prevention and management strategies for individuals at risk of developing autoimmune conditions. What impact does stress have on the triggering of autoimmune skin conditions? Stress can have a significant impact on the triggering of autoimmune diseases. Here are some key points regarding this relationship. Immune system dysregulation. Chronic stress can lead to the dysregulation of the immune system, resulting in under- or overreactive responses. This imbalance may trigger autoimmune responses where the body mistakenly attacks its healthy tissues. Inflammatory response. Stress activates the hypothalamic pituitary adrenal (HPA) axis, leading to increased production of cortisol and other stress hormones. While acute stress may initially suppress inflammation, chronic stress can result in persistent inflammation associated with many autoimmune conditions. Behavioral factors. Stress often leads to unhealthy coping mechanisms such as poor diet, lack of exercise, smoking, or alcohol use, which can further compromise immune function and contribute to disease progression. Genetic predisposition. For individuals genetically predisposed to autoimmune diseases, stress may trigger or worsen their condition. Psychological impact. the psychological effects of chronic stress, such as anxiety and depression, may also influence physical health and exacerbate symptoms in individuals with autoimmune disorders. Overall, managing stress through techniques like mindfulness, therapy, exercise, and social support is important for individuals at risk for or living with autoimmune diseases. 5. How do hormonal changes influence the development of autoimmune skin conditions? Hormonal changes can significantly influence the development of autoimmune diseases through several mechanisms. Immune system modulation. Hormones such as estrogen and progesterone can modulate immune responses. Estrogen can stimulate immune activity, possibly contributing to a higher prevalence of autoimmune diseases in females. Thymus function. Hormones affect the thymus gland, crucial for T-cell development. Changes in hormone levels can alter T-cell maturation and function, potentially leading to autoimmunity. Thymus supplementation should be considered after the age of 30. Cytokine production. Hormonal fluctuations can impact cytokine production and signaling pathways that regulate immune responses, promoting inflammation or altering tolerance mechanisms. Genetic predisposition. Certain hormonal changes may interact with genetic predispositions to trigger autoimmune conditions in susceptible individuals. Environmental triggers. Hormonal changes during puberty, pregnancy, or menopause may coincide with exposure to environmental triggers, e.g., infections, that could initiate or exacerbate autoimmune processes. In summary, the interplay between hormones and the immune system is complex and varies among individuals, contributing to the risk of developing autoimmune diseases. What foods are linked to autoimmune skin disorders? Certain foods have been linked to triggering or exacerbating autoimmune skin disorders in some individuals. These may include gluten found in wheat, barley, and rye, can trigger reactions in those with gluten sensitivity or celiac disease. Dairy. Some people may react negatively to lactose or proteins found in dairy products. Nightshades. Vegetables like tomatoes, potatoes, eggplants, and peppers can cause inflammation for some individuals. Processed foods. High in additives and preservatives that may provoke immune responses. Sugar. Excessive sugar intake can lead to inflammation and worsen symptoms. Alcohol. Can irritate the gut lining and affect immune function. Individuals with autoimmune conditions may wish to consult with a healthcare professional or nutritionist for personalized dietary advice. Which chemicals and toxins lead to autoimmune responses in the skin? Several chemicals and toxins have been associated with triggering autoimmune responses. Some of the notable ones include heavy metals, mercury, lead, cadmium. Solvents, benzene trichloroethylene, TCE, perchloroethylene, PERC, pesticides, organophosphates, carbamates. Industrial chemicals, silica, dust, asbestos. Pharmaceuticals, certain antibiotics, e.g., penicillin, amoxicillin, anticonvulsants, e.g., phenytoin. Food additives and contaminants. Gluten in susceptible individuals can trigger autoimmune responses, particularly in celiac disease. MSG. Environmental pollutants, polychlorinated biphenyls, PCBs, dioxins. Exposure to these substances may lead to immune dysregulation and contribute to the development of various autoimmune diseases, but individual susceptibility varies widely based on genetic and environmental factors. What is the significance of gut health in autoimmune skin conditions? Gut health plays a crucial role in autoimmune skin conditions due to the gut-skin axis connection between the gastrointestinal system and skin health. Here are some key points regarding its significance. Immune system regulation. A healthy gut microbiome helps regulate immune responses. Imbalances in gut bacteria can lead to systemic inflammation, potentially exacerbating autoimmune conditions. Nutrient absorption. The gut is largely responsible for absorbing essential nutrients that support skin health, such as vitamins A, D, E, and omega-3 fatty acids. Poor gut health can impair nutrient absorption. Inflammation control. Gut dysbiosis, imbalance of gut bacteria, can increase intestinal permeability, leaky gut, allowing toxins and inflammatory substances to enter the bloodstream and trigger skin flare-ups. Microbiome diversity. A diverse microbiome is associated with better overall health and may help reduce the severity of autoimmune reactions. Dietary impact. Diets rich in fiber, probiotics, and prebiotics promote a healthy gut microbiome which may improve symptoms of autoimmune skin conditions like psoriasis or eczema. Maintaining good gut health through diet, probiotics, and lifestyle choices can be beneficial for managing autoimmune skin issues effectively. Which vaccinations or medical treatments trigger autoimmune reactions in susceptible individuals? Yes, vaccinations and certain medical treatments can trigger autoimmune reactions in some individuals. While vaccines are generally safe and effective, recent studies indicate that the mRNA shots may provoke an autoimmune response, particularly in those who are already predisposed to autoimmune conditions. Similarly, some medical treatments, especially those that modulate the immune system, certain biologics, mRNA, or chemotherapy, can also lead to the development or trigger of autoimmune diseases. It's important to discuss any concerns with a healthcare provider who can evaluate individual risks and benefits based on personal health history.